Most students can list asthma drugs but fail to explain them in exams. If you want to understand asthma pharmacology in a way that helps you write answers confidently and score more marks, this video is for you. Hi everyone, welcome to my channel. Today we will cover full pharmacological management of asthma in clear logical format. So in this video, I am going to cover drug classification, mechanism of action, dose, duration, uses, side effects, adverse effects, drug interactions, patient counseling, and exam tips. Asthma is a chronic inflammatory disease of the airways. The main goal of asthma treatment are to relieve bronchoconstriction, to control airway inflammation, to prevent asthma exacerbations. Asthma drugs are classified into reliever drugs, controller drugs, and add on therapies. Let us now discuss each drug class one by one in a logical clinical sequence. Short acting beta 2 agonist SABA drug is albuterol, also known as salbutamol. Short acting beta 2 agonists are the first drug used in asthma because they provide rapid relief. Albuterol works by stimulating beta 2 adrenergic receptors present on bronchial smooth muscle. This leads to relaxation of airway muscles, causing bronchodilation and easy airflow. Albuterol is used as a rescue inhaler. Dose is 1 to 2 puffs every 4 to 6 hours as needed, and the duration of action is 4 to 6 hours. And it is used in asthma attack, acute asthma attack, and rescue medication, and used as exercise induced asthma. Side effects include tremors, nervousness, palpitations, whereas adverse drug reaction includes tachycardia, hypokalemia, arrhythmias. Drug interaction, it will interact with the beta blocker which reduce its effect, whereas the MAO inhibitors increases toxicity. Coming to the patient counseling, this inhaler is a quick relief only, not daily prevention. If the patient needs it more than twice a week, asthma is poorly controlled. Short acting muscarinic antagonists, SAMA. Drug include ipratropium bromide. Ipratropium is an anticholinergic bronchodilator. It works by blocking muscarinic M3 receptors, preventing bronchoconstriction caused by the parasympathetic nervous system. It is less potent than albuterol, but useful as an add-on drug, especially in acute attacks. Doses include 2 puffs every 6 to 8 hours as needed. Duration of action is 4 to 6 hours. And it is used in the acute asthma, especially if the SABA intolerance is there. And the side effects are dry mouth and cough. A rare ADR includes the urine retention. Drug interaction is with other anticholinergic drugs. And coming to the patient counseling, avoid spraying in the eyes, drink enough water. Long-acting beta-2 agonist LABA drugs includes formoterol, sormetrol. LABA provides long-acting bronchodilation, but they do not treat inflammation. Therefore, LABA must never be given alone in asthma. They are also prescribed in combination with the inhaled corticosteroids. The doses include fixed dose of inhaled corticosteroid plus LABA inhalers. Duration of action is about 12 hours and it is used in the maintenance therapy in moderate to severe asthma. The side effect includes tremors and headache, whereas the ADRs include increased asthma related death if used alone. And drug interaction is with beta blocker and MAO inhibitors. Coming to the patient counseling, this is not a rescue inhaler, always used with it in ICS, inhaled corticosteroids. Long-acting muscarinic antagonist LAMA drug tiotropium. Tiotropium is long-acting anticholinergic drug. It provides sustained bronchodilation by blocking M3 receptor for 24 hours. Dose includes 2 inhalation once daily and the duration of action is 24 hours. Uses add-on therapy in uncontrolled asthma. Side effects include dry mouth, whereas adverse effects include angle-closure glaucoma if sprayed into eyes. So patient counseling is used once daily. Avoid exposure. Eye exposure. Inhaled corticosteroids, ICS, most important drugs. Drugs include budesonide, fluticasone. So inhaled corticosteroids are the cornerstone of asthma management. Asthma is primarily an inflammatory disease and ICS directly reduce airway inflammation. They decrease mucus protection, airway edema, and eosinophilic infiltration. Dose include low, medium, and high doses. inhaled daily, depends upon the severity. And the duration of action is long-term control, effects seen after days to weeks. Uses includes mild, moderate, severe, persistent asthma. Side effects are hoarseness, sore throat. Adverse effects include oral candidiasis, thrush, adrenal suppression is due to the high doses. Drug interaction includes CYP3A4 inhibitors, increases systemic steroid levels. Coming to the patient counseling, use daily if symptoms are absent. Always rinse the mouth after inhalation to prevent oral thrush. Systemic corticosteroids, the drugs includes prednisone. Oral corticosteroids are used in the case of severe asthma exacerbation to rapidly control inflammation. So the dose include 40 to 50 mg per day for 5 to 7 days. Coming to the ADR, osteoporosis adrenal suppression. And the patient counseling is short courses, usually do not need dose tapering. Coming to the methylxanthines, drug include theophylline. Theophylline causes bronchodilation by phosphodiesterase inhibition, but has a narrow therapeutic index. Doses include individualized based upon the serum level monitoring is required. And the duration of action is 12 to 24 hours and it is used in refractory asthma. Coming to the ADRs, it includes seizures and arrhythmias. And the patient counseling is to avoid caffeine, regular blood test is required. Coming to the leukotriene receptor antagonist, drug include Montelukast. Leukotrienes causes bronchoconstriction and inflammation. This Montelukast blocks leukotriene receptors, reduce asthma symptoms. So the dose includes 10 mg orally once daily in evening. Duration of action is for 24 hours and uses in allergic asthma, aspirin induced asthma. Side effects include headache, whereas the adverse effect is neuropsychiatric effect, and the patient counseling is report mood changes immediately, not useful for acute. So coming to the mast cell stabilizers, examples includes cromolyn sodium. Coming to the mechanism of action, it's act by preventing mast cell degranulation, thereby it will reduce the bronchoconstriction. So the uses is prophylaxis in mild asthma, and coming to the patient counseling, it is not useful in acute attacks. Last treatment option, if the asthma is not controlled by any other steps, then it is a last treatment option which include the biologic therapy. In the biologic therapy, biological drugs target specific immune pathways and reserve for severe uncontrolled asthma. The drugs includes amalizumab, which is anti-IgE, which is specially allergic asthma given in, and the next drug is mepolizumab and benralizumab, which is anti interleukin 5 and especially given in eosinophilic asthma. And another is dupilumab, which is anti interleukin 4 by 13 type 2 asthma. In this slide, I am going to explain about very important points which are important for exams bits type, and it include inhaled corticosteroids are the foundation of asthma therapy, and LABA must never be used alone. Overuse of SABA indicates poor asthma control. SABA is equal to reliever. SABA overuse is equal to poor asthma control. ICS is the first line controller. LABA never should be used alone, and theophylline is a narrow therapeutic drug. Here, the therapeutic drug monitoring is very important. Montelukast has neuropsychiatric warning, and the biologicals are for severe asthma only. Thanks for watching. For more concept based videos, follow these channels, like and subscribe.